morning, everyone. I am the second international non-American speaker. Thank you, Kevin, for the invitation. And I'm not a scientist or a lawyer or a campaigner, but I have done policy making in different places in the UK and in Canada. And I was invited to speak about Canada because I think so much of what I heard today and yesterday is about the missteps and the missed opportunities of what has happened in the US in the last couple of decades, and the concern that you all have about how legalization has played out here at the state level. Canada is very interesting as a separate country. I'm sure you all know that. And a country that's already taken a very important step. So my presentation will talk a bit about Canada overall and drugs policy, how it's played out there. I've lived there now for about 6 years myself in Vancouver. And then I'll talk a bit more about, perhaps with some more upbeat news, what's happening in a province called Alberta. And I've done some work there for the government, which I think holds some promise. So, let me see if I can start with an overview to sort of set the scene for you. So, this won't be news, obviously. I think actually Prime Minister Justin Trudeau said this to your president recently, which is the fentanyl and opioid crisis in Canada is not just an American problem, it's very much a domestic Canadian problem too. And this has been unfolding for 20 or more years in Canada with some of the same drivers that you all know about down here. In fact, Keith Humphreys was the first person to point this out, but British Columbia, where I live, certain parts of the lower mainland have an opioid overdose rate as bad as the worst parts of the US. In 2017, the chief medical officer in BC declared a public health emergency, so 8 years ago now, and every year the death toll has increased. The western provinces of BC and Alberta are the worst affected, and have suffered, as Kevin mentioned in his opening remarks yesterday, from this sort of permissive policy agenda, which has been highly experimental, but has been driven and doubled down on over many, many years. So Vancouver being the focus of a lot of the most experimental policies that we've seen, so-called safe supply, supervised consumption sites, and the like. The other thing that I think is worth stressing with Canada is that there has been a general belief that the most noble and honourable position on drug policy is always to concern yourself with saving lives in whatever way you can. And so the permissive policy agenda that has developed has moved away from 4 pillars in somewhere like BC to very much 1 or 2 pillars where enforcement isn't just downplayed, it's talked about publicly as a counterproductive effort, a waste of police time, and in some cases a very dangerous and harmful thing to be doing. So the consequences are that our entire policy debate and discussion is about the metrics we count, the negative and terrible metrics of people who have died. Government doesn't seem interested in measuring whether treatments are working, how many people are getting into treatment, how many people are successfully graduating treatment, and what recovery outcomes look like. So are we investing in these things? Well, not to the extent we should, but more to the point, we're not even counting some of these recovery outcomes. So how are we hoping to have a better long-term change if we're not interested in measuring anything beyond drug mortality? That said, this is our bad news chart. Dr. Madras gave the US numbers. Canada is 39 million people. These are monthly accidental opioid toxicity death numbers per quarter. So about one-ninth the size of the US population, but as you can see, Health Canada does a projection which is what they expect to happen in the future. And things may be plateauing or maybe not, but they're certainly not improving. And that dramatic increase that we see there is the same story that we've seen in the US as well. There's also a problem, I think, with enforcement, and I say this being a strong believer in policing and in the role of the justice system. I just think they have been disinvested and disintermediated in the debate. And I also think as policymakers it's really hard for us to show this, because the police are typically very can-do and just get on with doing their work and doing the busts and doing the interdiction. We have struggled to find a way of measuring and valuing that contribution to drug supply reduction. There are some numbers that I pulled from July 24 report from StatCan, and I just think this shows us that if we're doing enforcement, we're probably not doing enough of it. I couldn't find data for all classes of drugs, and this is broken down by province as well. If you want this data, it's all available. But no more than 4 people in any of the last 6 years have been charged, just charged, not convicted, for the serious offences of smuggling opioids. So that's importation or exportation, countrywide. So I'm not saying your new US administration has a point here, but there is something wrong with the enforcement effort going on in Canada. It's either not resourced properly, it's either got different political priorities than perhaps what it needs to have. And I won't go into more questions on the border enforcement and if it's there, but there was a major bust in Edmonton a couple of weeks ago by their alert team, one of the largest for many years. But it does tell us that there's a domestic fentanyl problem in Canada, and some of that is coming back across the border to you guys. But some better news. So Alberta is one of the western provinces, about 4.8 million people live in Alberta. And they've had the same government for a couple of terms now. They had a new government elected of the same party, a Conservative government in 2023. And they have, since about 2019, 2020, been very innovative around drug policy and pursuing a recovery-oriented system of care. And you heard a bit about that earlier in terms of effective approaches to long-term demand reduction. So they have this continuum of care, they've got an innovative approach to virtual opioid prescribing, on-demand, and free opioid access. They have invested hundreds of millions of dollars in capital costs of new recovery communities, and these are purpose-built residential recovery communities that are voluntary to attend, and they will over time, and there's I think been 3 of the 11 have opened, but the rest will follow in the next couple of years. These institutions will really help with long-term effort to improve recovery outcomes and to reduce demand. They've set up a new Crown corporation called the Canadian Centre for Recovery Excellence, which I encourage everyone to look at and go to the website. They're brand new, they're only opened in the summer, so they're hiring, they're finding office, they're looking for research opportunities, developing their research plan. But I think with that, it's a demonstration that Alberta is investing in some of the people and the infrastructure you need to develop better drug policy. The last thing there is something that my colleague Phil Tubin will speak more on in his presentation. But one of the interesting things about Alberta is that they have reviewed or have begun a review process for how their cannabis legalization model works. The first province, I think, in Canada to do that, and there'll be some reforms coming out of that work, which will probably happen later this year or next. Because this is the overarching point I want to make, which is, despite all of the efforts that are made in state-based advocacy here in the US, in Canada, the legalization ship has sailed. So the 2018 Act was passed. There's no political appetite for federal parties at the moment to reverse it. And federal law that governs the legal It does do things quite differently from here in the US. So I don't think this is true of any states in the US, but federally in Canada, there's marketing restrictions, quite strict marketing restrictions. Sets possession limits on homegrown or home cultivation. And crucially, this is to the point of child-safe packaging, plain packaging, complete prohibition on branding, advertising, no TV, radio, billboard advertising, no corporate sponsorship of events, no dressing up a local charity partnership donation as a charity grant. Actually, it's a way to market your product or market the cannabis company. None of that is allowed under Canadian law. Now, below that are 10 provinces that regulate supply and retail. And they've adopted different models depending on where you live and the politics locally. Alberta, Saskatchewan, more conservative, free market. Provinces have opted more for a private retail model. But somewhere like Quebec, much more government controlled and more restricted, higher minimum age, for example. You can access cannabis younger in some provinces in Canada than others. With these marketing controls, this means one important thing, which is the retail store is the marketing vehicle for the cannabis industry as a whole in Canada. There is no brand opportunity, there's no sponsorship. So when you open a retail store licensed by the province, it becomes a shop window not just for your, not just for cannabis, but for your company and for your brand. So it's very dependent in which part of Canada you live as to how you experience this legalization that happens around you. As I said, still the majority support legalization, but that has reduced over time. No prospect in the near term of it being rolled back. And what are the effects we've seen so far? Well, Phil will talk some more about the rising rates of youth. We've had a glut of products initially in the first few years, lots of oversupply. There's still an illicit market, of course there is, up to 30% estimated to be still there. And an increased share of the sales are now in the higher potency products. Tax revenues aren't growing, but they're still behind alcohol, but in some provinces they're now substantial. Alberta is interesting because it's quite a conservative province, as I mentioned, but they've had or adopted quite a liberal regime on legalization, so they have the lowest majority of any province. In fact, the lowest of any of the 39 jurisdictions we looked at across the world that had some form of adult use regime, so you can legally buy cannabis as an 18-year-old in Alberta. You have to be 21 in Quebec. They have no cap on the number of stores, no restriction on the products or potency of those products, and they don't have the sales tax either, so the actual purchase price is lower. And they've allowed recent liberalization to Uber Eats delivery, for example, for home delivery. And so we've had this saturation of stores. If you go to Alberta, they'll be everywhere. 752 by the last count. That's 40% more stores per capita than Colorado. And high demand and rising some revenue numbers there, so not far off later, but bringing in a substantial amount, and up 9% in terms of revenue last year. In terms of this review of legalization, one of the things we wanted to do was to survey Gen Z, I suppose Gen Z. They are 18 to 29, and most surveys in Canada, although we do have some good data, we do have some good national surveys, they either don't give us provincial data or they give us provincial data but not at a level where we can break it down by age. So we went with Blair Gibbs to do a more detailed survey just in Alberta of that age group. And I think some of the takeaways here are to the discussion we've had over the last couple of days. So about 7 in 10 youth in Alberta of that age group tried cannabis once in their lifetime. And 2 in 10 now are daily or near daily users. A third of those who used cannabis last month use it on a daily basis. And of course motivated by, what are their purchasing choices? They're motivated by price, they're motivated by THC potency. So the industry is obviously pursuing the same model that we saw about yesterday, which is small number of users, high demand, wanting high potency, responsible for the majority of the revenue. And then this point about the illicit market. So there's 14% who said in the survey that they would never buy from a licensed retail store. In other words, they have their own arrangement. And then this point at the bottom, as I say, I'm not a doctor or scientist, but this was a concerning result from the survey. We asked the standard Harvard questions around impact on people's mental health, and this is what it told us. So 4 in 10 had some negative experience. But when asked standard curative questions around cannabis use disorder, 1 in 6 scored 12 or higher. And this is much more the case with people whose consumption was started before the age of 18. These are the reasons I think Alberta therefore matters. They're doing this review. There could be some tightening of the laws around cannabis legalization as a result. They're investing in infrastructure and people to not just improve the evidence base, improve the science, but also to build the necessary recovery beds and facilities we need to help people with addiction. And lastly, they're actually investing in the training that people need to support the kind of recovery mentoring that was talked about earlier. I think there'll be some future changes here that we should keep an eye on, particularly in the US. So the Canadian Centre will be issuing calls for new research grants as well going forward, so there could be some interesting opportunities to work collaboratively with maybe some US and Canadian researchers looking at the same thing. New models for prevention, I think they're looking actively at whether there's an actual need for a specialist cannabis use disorder network of clinics just for that particular presenting problem. We know that there's good work going on with campuses in University of Alberta, some of it borrowed, I think, from Texas. They're also exploring, they haven't said anything publicly, but they're exploring whether there should be social responsibility levies of some kind to, again, raise extra revenue that can be pumped back into prevention and recovery. And there's also the possibility that anything that Alberta does might have some influence to a future federal government. We have an election at some point this year, and it could be a change of government, a new Conservative federal government. So what would they want to be doing on drug policy nationally? Will we see prevalence rates increase and continue to go up? Phil will talk some more about what we've seen so far. Will we see a more sort of bigger shift away from permissive drug policies? Still too early to say, I think. We don't know what the border measures will do in terms of the illicit market. We've had the announcement of fentanyl czar. We'll see who that is and how much impact they can have. I think we need to find ways for provinces to raise more money to invest in prevention and treatment. And then again, I think as a federal system, the big question is, will a Conservative federal government be more activist and be more involved in supporting good drug policy at a provincial level? Because traditionally the federal government has left that to provinces. They control health, they control housing, they control employment policies, etc. So they've tended to step back. So we'll see. But I think the big overall point for this audience is that you have a really hard challenge, because not just federal regulation or federal legalization is still a future prospect here, but state level legalization has happened in a way that is unthinkable in Canada because of your liberal approach to advertising, marketing, and to the limits of the industry that way. You're facing a particularly serious challenge to resist and to push back against. That said, even in Canada, where these controls are strict and where regulations prohibit a lot of that activity, we are still seeing an increase in use. We're still seeing an increase in impact in emergency rooms and impact on mental health. So you can regulate and legalize, but don't think that you get away from any of these downstream effects, even if you have a very un-American model, which is very much focused on